Hello, my name is Amir Aran, MD. I'm an orthopedic hand surgeon, and today we'll be talking about trigger finger. First of all, I would like to state a disclaimer. This is not medical advice, and you should approach a professional in order to seek medical advice and to follow it. But I will now be giving you an explanation about trigger finger. So, these are our fingers. Our fingers move when they're using two tendons in order to flex the finger. There's the flexor digitorum profundus and the flexor digitorum superficialis. One is deep and one is superficial. The tendons in your hand pass through a series of pulleys. Here I drew the A1 pulley. This is the culprit of the trigger finger. If your finger flexes down and you're not able to extend it, if it flexes down and bops, if you find that it flexes down and then it triggers, it goes straight with like a pop, these can all be symptoms of trigger finger. What happens during trigger finger is the fact that the A1 pulley constrains, and actually what happens is that this proximal end of the pulley becomes thicker. We assume it is because you are draining and straining your hand over the years, but this can also happen due to other reasons like diabetes and other diseases. Once you have triggering in your finger, you might seek treatment. Treatment for the pain locally can be done conservatively by either applying some cream, using non-steroidal anti-inflammatory drugs. You can do some physiotherapy locally, add a splint with hand therapy, and use hand therapy in general. When conservative measures fail, you might also try adding another conservative measure, which will be a local injection of steroids over your A1 pulley in this area of the hand. Remember that I usually recommend doing only one injection into this area because this might harm the tendons underneath the A1 pulley. In that case, you might have a dreadful complication, which is a tear of the tendons flexing your finger. This will entail large surgery and is a very dreaded complication of injection locally. Once you decided that you've had enough of conservative treatment, you can opt for surgical intervention. The usual surgical intervention will have a surgeon anesthetizing you locally at the area here of the A1 pulley. As you can see here, this is the tendon, and the tendon actually moves underneath the A1 pulley that compresses it. So once you have the A1 pulley pressing on your tendons, your finger will close down and then pop. What you do during surgery is you incise along the A1 pulley and you release the flexor tendons going into your finger. The surgery is relatively simple, is done under local or under local with some sedation. Some might opt to do it with general anesthesia, but this is not the usual case, and it is generally very successful. So as I said, the flexor tendons go through the pulley is inside longitudinally usually, and the flexor tendons are released. There might be synovitis around it, which is an inflammation. This will subside over time. Stitches will be removed usually after 10 to 14 days, and you should be moving your fingers quite freely after the surgery. So this is trigger finger for you. All the best. Thank you very much. I was Amir Aran, MD. Thank you.